Greetings, everyone. Welcome to Season 2, Episode 6 of IVSA Kelantan podcast show. The topic for today is Veterinary Cardiology in Small Animal Practice. Together with us today is Dr. Melissa Yo. Dr. Melissa graduated from DVM UPM in the year of 2017. From the year 2017 to 2020, Dr. Melissa kickstarted her career as a small animal practitioner in Gasing Veterinary Hospital, PJ. Fascinated by the dynamic nature of the heart, she developed interest in veterinary cardiology during her years as a junior veterinarian. Since then, Dr. Melissa attended various veterinary cardiology workshops, seminars, and courses locally and in Southeast Asia to expand her knowledge and skills in this field. Currently, she is working as a locum veterinarian providing medicals and cardiology consultation to pets in need. On the side, she is also the co-founder of the NGO The Passerby, which serve as a platform to educate and raise public awareness on trap, neuter, release, and manage as the most humane approach in controlling stray population worldwide and in Malaysia. Welcome, Dr. Melissa. How are you doing today?
Hello, everyone. Thanks for having me. I'm very glad and fortunate to be given this chance to join this podcast recording. And then I'm very happy to meet all of you. So I'm doing very well. Thank you very much.
Okay, to start off our podcast, Doctor, what inspired Doctor to pursue this field of specialty?
Okay, I think first and foremost, I would like to give thanks to my previous boss, which is Dr. Prem, for his guidance throughout my years in Gasing Veterinary Hospital. Yeah, he was my inspiration when I first started out. Yeah, and also besides him, Dr. Prem, I think my main inspiration as a vet in general would be my patients. So my patients, as you know, in small animal medicine, it involves mainly dogs and cats. So I'm particularly interested since the beginning of my career. I've been interested in small animal medicine. So as the years goes by, I developed this interest in cardiology, mainly because I realized and also I noticed that there's a various presenting signs, the diagnostic workups, and also the treatment response by the patients, especially. Whenever we started any something, for example, the treatment, we started doing diagnostic, and then how they respond to the interventions. I realized that I can actually make a difference for these patients and also the owners. So I think mainly would be the patients or who have actually inspired me a lot to continue going into this and become better for them. Yeah.
Wow, that's a great inspiration experience from Doctor. So
Mm.
the next question, we would like to ask, what is the education pathway to becoming a specialist in veterinary cardiology in Malaysia?
Mm. Okay, I think this is an interesting question because as far as I know or we know of, currently I think there's no specialization training program in Malaysia. For example, from what I know of, if we want to be a board certified specialist in a particular field, we actually have to go through things like internship, residency for many years, and then you have to go through the board examination to be called as a board certified or internationally recognized specialist. But we don't have it here in Malaysia yet, although it's in the planning from what I know of. Probably in the future, we will have this route. However, there are also other routes to be more proficient in this field of cardiology, for example. So like for example, nowadays we have many online or in-person courses, workshops, master programs like the one provided by ESAVS or even like certification. So I think all these are different ways for us to be more proficient and better in this field besides this specialization training program. Of course, if you are into going you are into this specialist to become this specialist, you can try to find out how to enroll in these programs, and then to be part of the training program to be a specialist. I would say, yeah.
Thank you, Doctor. That's a very
Hmm.
good sharing from you, and
Hmm.
I believe it will be useful for those people that are interested in veterinary cardiology pathway too. So,
Hmm.
for the third question, Doctor, is there a
Hmm.
demand for veterinary cardiology in Malaysia?
I would say there's definitely a demand because the main part of it is because um, the pets, for example, the animals, even like us, okay, the dogs and cats, they are always aging. Okay, so besides the degenerative changes which we commonly see in heart patients, for example, in small breed dogs, we always have the myxomatous mitral duct valve disease, and also other predisposed heart conditions, for example, DCM in large breed dogs, and also maybe HCM or RCM in cats. So those are actually part of the breed and the aging process. We also have congenital heart disease, which may be underdiagnosed in Malaysia still because of the lack of experience, maybe in terms of diagnosis, in terms of presenting signs, like how we miss out those signs, and because of that we didn't follow through the diagnosis and treatment. So that may be one of the reasons. There's still a demand for it. Okay, and also I would still think that the vet cardiology scene in Malaysia still has a lot of space for improvement, especially in terms of intervention, or for example, ballooning or even surgery, if we have to go through into that. Currently what we have right now is mainly medical treatment. At most also we can have a very simple surgery which doesn't involve an open heart surgery yet. So I think there's definitely demand, and we can always do more and do better in this, I would say, in Malaysia. Mm.
I see. Thank you so much,
Mm.
Doctor, for sharing about the demand of veterinary
Mm.
cardiology in Malaysia. So, for
Mm.
the fourth question, we would like to know, are there any notable difference in your current work as compared to other small animal veterinarians?
I would say yes and no, because as you know, as we mentioned just now, I'm currently working as a local vet. So local vet, it's considered self-employed or like a freelance vet. It's different from a full-time vet. um, so besides the working hours, mainly my work is almost similar to other small animal vets. It's just that I'm seeing more cardiac related cases, for example, consultations, diagnosis, treatment, and also follow-ups. Um, and besides that, I will also see other medical cases. Um, what I want to mention is also the heart itself. It is, I would say, the center of the system. So, a lot of time, what I experience is that it doesn't just involve the heart. We also have to look into other causes or other factors that might contribute the heart problem, or the heart might affect other problems. So, for example, neurohormonal system, or maybe even renal diseases, um, circulatory diseases. So all these are actually interrelated with the heart diseases. So I think we always have to deal with that, no matter how specialized you want to go into this field. Yeah.
Thank you so much, Doctor, for answering these questions and sharing with us how actually your current works is done. And
Hmm.
for the next question, I will pass on to Natalia.
Yeah. Hi, Natalia.
Alright. Hello, doctor.
Yeah.
Alright. The question that will be coming from me is
Hmm.
what are the challenges that doctor come across in this field, and what set of skills do you incorporate into paving your pathway in your work with small animal cardiology?
Okay. Challenges, I would say, um, if let's say we are talking about cardiology or cardiac related I think it would be new or rarely reported heart conditions, which can be or mainly would be congenital heart diseases, because degenerative changes, for example, mitral valve diseases, these are commonly seen, but there are also a lot of rarely reported conditions that we haven't encountered. So whenever I face that situation, most of the time I wouldn't think it as a challenge. I would actually see it as I'm actually intrigued by that situation. And also it's just that it would require more effort from my side to actually find out what is actually the cause. For example, that after doing an echocardiography, I will actually have to keep looking into that echocardiography to see what findings I might have missed out, or yeah, what new approach that I can do to actually to try to diagnose better, things like that. So I think that is one of the challenges. The other challenge I would say is also things that we may have not started in Malaysia. For example, surgical or advanced interventions like ballooning or things like that. So, for example, patients which may benefit from these interventions, but we are not able to carry out those procedures yet in Malaysia. So, I would actually feel kind of bad for the patient, because we might be able to do something if we have that facility and we can do more about it. But of course, I also understand that the cost is one of the issues that we might face in for these patients. Yeah. So and also, what set of skills do I have to incorporate into my work? I would say usually for cardiology, a lot of times we have to evaluate the diseases subjectively and objectively. So meaning we can't be seeing just the for example, echocardiography, we actually have to do measurements. So if we only look at the measurements, which is objective approach, we might miss out other dynamic features of the heart. So we have to look at subjectively as well. Yeah. So, and another thing is that we actually have to think of the bigger picture, like what I mentioned just now. Not we don't just focus on the heart. We have to think of other possible causes, that of other systems which may be part of the factors of causing this heart problem, or either way. Yeah. And also always be consistent with your work, and also always be humble and modest to learn from others, because we are not the best. We will have to learn, keep on learning, and then learn from the best, or learn from the the, the people who are better than us. Mm, yeah.
All right, doctor, that truly is interesting. So the next question is it common to receive referrals from general practitioners? And what are the most common or most interesting cases that you have encountered?
Okay, so from the nature of my work, because I'm working as a local vet, I would usually, how to say, receive referral cases which is referred to the practice that I'm attached to, or the patients from that practice themselves lah. So usually, yeah, if let's say there is this service, or like for example, I'm over there, I'm attached to this clinic, and there is this service. Usually, there will be referrals coming in. Yeah. So, what are the most interesting cases? There's not just one interesting case so far. Every day, I mean, almost every time I have a session with the pets, there will always be new interesting encounters. But there's one particular patient that I can share with you. It was few years back when I was still in Gasing Vet Hospital. It was actually a very old, geriatric 15-year-old cat, 15 or 16, quite very, very old and grumpy cat. So at that time, he was presented over with feline aortic thromboembolism. Yeah, and it was bilateral, and bilateral hind limbs. So both the back legs were already necrotized. It was already very badly affected, infected, and in fact, the cat was even developing signs of chronic infection and also IMHA, immune-mediated hemolytic anemia, due to the infection. The PCV, the HCT was always low. And then we actually have to transfuse for many, many times. And because of the IMHA, the cat was also rejecting a lot of blood from other cats. So it took us about 3 to 4 weeks to actually go through that. And the most extreme thing about this patient is that the owner uh, wanted to amputate both of the hind limbs. So as we know, feline aortic thromboembolism, a lot of time it is due to a primary heart condition. So the cat was actually having a severe HCM, both the atrium, especially the left side, the atrium was severely dilated. So for a heart condition as bad as that, to go through a major surgery to amputate both the hind limbs, and with the IMHA, it was actually very, very challenging. Took us a few hours to actually to carry out the surgery. And then after that, post-op, the cat actually still developed IMHA, and then we had to just pull through, and then there's just a lot of effort going through, a lot of critical care for this cat. Yeah, but fortunately, the cat actually survived for that few weeks. It also costed the owner a lot. Yeah, but in the end, after a year or two, he also passed away due to a second episode of feline aortic thromboembolism. Yeah, so that is one of the interesting cases that I remember until now. Yeah. Okay.
All right, doctor. That truly is amazing how veterinarians can handle cases like that. And then the next question is, what is doctors' future endeavors in order to achieve more professional standing in the field in terms of collaboration, research, or others?
Okay, I would say I'm very excited to keep developing myself in this field. I'm looking forward to having more collaborations with even even between the vets in Malaysia, those who are into veterinary cardiology, also vets or specialists or cardiologists, I would say, from other countries. Yeah, so yeah, I'm looking forward to that. In terms of personal development, I'm always looking for opportunities to continue study and to continue develop my skills, or training through trainings, through courses or things like that. So I think there's still a lot of work to do to work on myself, so that I can bring more to the table for our patients and for this field and also the industry. Yeah.
All right, doctor. Thank you so much for sharing your plans for the future. So before we end our session, are there any take-home messages that doctor would like to share to the public, pet owners, and also vet students that are listening to us?
Yeah, I think for the public, my main message would be to try to get your pets insured because I think that is one of the reasons a lot of times our patients um, will require more diagnostics and also treatments to actually find to treat or even to find out what kind of heart condition. But a lot of times that is due to the cost. So if let's say we can get them insured, we can actually do more stuff. I mean, the vets can actually do more. So that is one thing for the pet owners out there. And also to always be kind to your vets because as we know, we are always trying to do our best for the pets, and we are always learning. So I think, yeah, just be considerate and always discuss. I think for the vets ourselves also, we will also have to keep our messages open and also be clear with the owners. Always initiate conversations, open conversations with the owners. Yeah, to so that they actually understand what we are going through and what they can do for their pets. Yeah, for the vet students like all of you, I think the main my main advice or maybe sharing would be to enjoy your vet student life currently. Of course, that's the best years that I still appreciate until now. But when you are out working as a vet, always be open to learn more. So of course, this vet cardiology is something that is really interesting. There's also a lot of other specialties that we can further into. But when we first started working, I think the fundamentals or the basics are very important. So always learn your basics first, learn our fundamentals first. Even until now, we are still learning. So, and then consider going into things, specialties or fields that you are really, really interested so that you can, develop yourself and become a better vet. Yeah. So that's my message. Thank you.
All right, Doctor. Thank you so much. And that's the end of our sixth podcast episode. It truly was an interesting topic that we had today as we got to know more about veterinary cardiology. To summarize today's session, veterinary cardiology is an intriguing area to pursue, especially given the demand in Malaysia. We hope that this podcast session will open our listeners' eyes and encourage our fellow veterinary students to further explore in the field of veterinary cardiology. Thank you again, Dr. Melissa, for taking the time to talk about this topic with us today. So, for our listeners, thank you for tuning in on our podcast. And once again, thank you to our team for making this podcast episode possible. Have a good day, everyone, and stay safe.